Dr. Padilla, how effective would a federal vaccine mandate be? Is that the answer at this point?
I think, Lacey, we do have to look at not just carrots that we've been doing and removing the structural, barriers to getting vaccinations, but mandates or requirements for vaccines have to be looked at. Traditionally, the way that governments, not so much federal governments, the state governments have been involved with mandates is that they're requiring, as you may know, with anybody who has kids in school, there's requirements for vaccinations for infectious diseases. And that's how we've curbed infectious diseases in the past. We're at a position right now, you just said it, half of us are vaccinated. And there's a poll that says 45% of those who are not vaccinated are saying they definitely do not plan to get vaccinated. And there's an Ipsos poll that says that those who are not vaccinated are much less likely to wear masks, and much more likely to engage in activities that are more high risk. We definitely do not have enough people vaccinated. With a more transmissible variant like Delta, to get to that herd immunity, you have to get there somewhere, right? And I think the way you do that is to mandate in universities, as we've seen, in schools, and actually employers to start looking at that as a requirement, vaccine requirements, as a way of coming back to work. And this is how they would do it. They would do it with offering, if you don't want to get vaccinated, that's great. Here's what you need to do. Increase testing, right? Wear a mask. You need to show proof of vaccination. And then if you don't, you need to do testing or wear a mask. And that's how we have to move to the other side. And data shows potentially that might move some people who are in the definitely do not vaccinate into the vaccinate column.
Eugene, while we think about mandates, Politico has reporting about vaccine resistance in rural America, especially the South, writing many people are turning down COVID-19 vaccines because they are angry that Trump lost the election and are sick of Democrats in Washington thinking they know what's best. State and local public health officials have struggled to combat that deep-rooted obstinance. But they don't want more on-the-ground help from the White House, fearful it would prolong the current surge, even as the Biden administration has begun approaching southern states with offers to send federal, quote, surge teams on door-knocking campaigns. Eugene, your sense of where the White House is on this issue overall and specifically on this question of mandates?
I mean, what we've seen is them get more aggressive when it comes to the misinformation and, most importantly, the disinformation that's out there, and a lot of it coming from the right wing and some of it coming from Republican politicians locally and federally. But when it comes to the mandates, they know that a mandate coming from them is not going to go over well. They're not very interested in it. And none of my sources I've talked to that work on the COVID task force or with the COVID task force have said that they even really taking it as seriously as presenting it to folks that would make that final decision, because they know that is not something, because of how politicized this all started, being the masks last year, when the federal government never mandated masks, right? They were recommended. And then the local officials and stores and restaurants, that's where things changed. And that's what they say they're going to continue to see. And I know people are frustrated. I'm frustrated that folks aren't getting vaccinated when we know that as this Delta variant is taking over and spiking. You saw that map that you guys put up, all of that red and orange. What that means is you have all of these people where we're going to see, and the president has said this, the vice president has said this, kind of like two Americas, right? You're going to have a pandemic of the unvaccinated, and that is the thing that we're seeing right now. They are not very interested, other than doing everything they've already done and continuing to throw all the spaghetti at the wall, trying to mandate anything because of how politicized everything is, and they know the connotation that's going to come with.
Dr. Padilla, there have been other guests who have argued that this language, pandemic of the unvaccinated, is actually making the problem worse by making something that is already divisive. Eugene, I've used it too, so I'm not calling you out because it's language. I think we are all looking for ways to describe what is happening. And I understand at the same time that sometimes that has implications that, not being a public health professional, we might not appreciate. Your thoughts?
I think that what we don't want to do, and in fact, it is in some ways the greatest burden. The human cost is carried by people who are not vaccinated. I think the problem with the term, and I have unfortunately used it as well, is because you don't want to stigmatize those, right, and sort of make the disease a stigmatization of the person who has not taken the vaccine. And that's where I think, rather than doing that, I want to agree with what Eugene said. I think a federal mandate will not work, but by changing the rhetoric, right? And we've seen that difference. At least like this week, we saw this big increase on with right-leaning politicians coming out in support of vaccines. And whether it's that or whether people are really seeing this increased burden among people who are unvaccinated, the daily vaccination rates have gone up. We've been at 500,000 for a while. Yesterday, we're almost up to 800,000. So some of that is working, but taking it a step further, right? Private businesses, employers have to consider whether or not they should potentially put on these vaccine requirements to come back to work, because it's going to keep their workplaces safe. And I think that might be more effective than a federal mandate.